year's ASH 2025, being there are many exciting abstracts being presented in the multiple myeloma space. I think a broad theme from several of the abstracts presented that really came forward was the incorporation of bispecific T-cell antibodies in earlier lines of therapy for multiple myeloma, including earlier relapsed refractory multiple myeloma and newly diagnosed multiple myeloma. And these antibody-based therapies have shown really unprecedented responses and even durability responses with longer follow-up in these contexts. And so I think this is really where the field will be moving in the years to come. Along that theme of the earlier incorporation of bispecific T-cell antibodies in multiple myeloma, I think the abstract that generated the most buzz was the late-breaking abstract presented on Tuesday morning, the MajesTEC-3 study. So this was a phase 3 randomized study that evaluated relapsed refractory multiple myeloma patients with 1 to 3 prior lines of therapy and randomized patients to either receive a BCMA bispecific T-cell antibody teclistamab plus daratumumab or standard of care triplet-based therapy, specifically daratumumab, pomalidomide dexamethasone, or daratumumab Velcade or bortezomib dexamethasone. And this was the first analysis of the trial that was read out. And really, in summary, the investigational arm of teclistamab and daratumumab showed a substantial improvement of progression-free survival compared to standard of care triplet-based therapy. And the benefit was pretty profound. Actually, this was the most positive study in relapsed refractory multiple myeloma in the history of relapsed refractory multiple myeloma studies, and saw a 3-year progression-free survival of approximately 83%. So really unprecedented responses and durability response compared to standard of care therapy. So this was really, I think, going to be a practice-changing research abstract. And one of the key secondary endpoints was actually overall survival. So actually the investigational arm of daratumumab teclistamab actually also showed an overall survival benefit, again, at the first interim analysis compared to standard of care therapy. And, this is actually very difficult to demonstrate in myeloma because, for a good reason, myeloma patients are living longer and longer, so that overall survival signal can be difficult to ascertain early on, but clearly there's a magnitude of benefit seen in terms of both progression-free survival and overall survival. One thing about the presentation, though, I think that's really important to note is that there is still infection risk when using bispecific T-cell antibodies. Again, in this case, teclistamab in combination with daratumumab, and so there's a 50% or a little greater than 50% grade 3 or higher infection rate. And so I think there were some data in the abstract presentation that showed the importance of the incorporation of IVIG for infection mitigation strategies. So I think this is another theme, I think, with ASH this year, is that how can we really reduce the risk for infections and other safety issues with bispecific T-cell antibodies, and IVIG use as primary prophylaxis has really been reinforced through the different presentations. We're also abstracts looking at bispecific T-cell antibodies in newly diagnosed multiple myeloma, and these are early studies, so less mature data in the MajesTEC-3 data that I just referred to, but two I think specifically stood out. So one was the IFM 2021-01 study. This looked at teclistamab and daratumumab in newly diagnosed transplant ineligible myeloma patients. These are older, frailer patients over the age of 70, and at least at a median follow-up of about 7 months or so. At this data cut, actually the overall response rate was 100%, and more exciting was that the actual MRD negative rate at a sensitivity 10⁻⁶ was 100% among patients that were MRD evaluable. So this is actually another unprecedented result as well. We have not seen such great results in newly diagnosed myeloma patients ever with just a 2-drug regimen for elderly frail patients. And so of course we'll be waiting additional follow-up with this abstract to see about the durability responses. And then what about bispecific T-cell antibodies as part of consolidation? There was a very interesting abstract called the ImmunoPlant study, in which patients receive standard induction therapy, either 3 or 4 drug regimens for at least 4 cycles. Among those that were MRD positive could then enroll on this linvoseltamab consolidation study. So patients received 4 to 6 cycles of BCMA bispecific antibody linvoseltamab as consolidation. Again, MRD negative rate is 100% at a sensitivity 10⁻⁶. So basically, if you get bispecific T-cell antibody combinations as part of induction, as part of consolidation, the end result seems to be MRD negativity at 10 to the 100 at 10 to the minus 6. So I think really, really unprecedented, exciting results. We'll have to wait for additional follow-up with these studies. I think as a general theme, we've just seen incredible progress in the treatment of multiple myeloma over the last 10 to 20 years. And I think we're actually seeing an acceleration of this progress really in the last couple of years. And so I think this is really exciting, of course, as a researcher, but also most importantly to patients. And I think there's tremendous new therapeutic approaches that are being explored in myeloma that are showing unprecedented responses, durability response. Now we're talking about even the curability of myeloma. And so I think, every time you come back from a meeting like this, there's just a sense of excitement that, what's next and what can we do better to have better outcomes for our patients, which is the most important thing.